Thank you so much for having me. It's a real pleasure to be here today. Before I start talking at you, I want to briefly hear something from you. All of you are clearly here because you have some interest in making research open. Either you're already doing it and you want to improve your practices, or you're interested in starting to make your research open. So I'd like to hear from you, and I'm going to ask you to put your answer to this in the chat, but wait to press enter until I say so. First, who your audiences are, who you hope that you are benefiting in making your research open, and what practices you're using to make your research open. So just take a few seconds to draft an answer to these questions in the chat, and then hold off till I say hit enter to share with the group. Okay, just finish up your answers, and on the count of 3, I'll ask you to hit send or enter. 1, 2, 3. Okay. So why do I ask you to reflect on these questions? And I hope you can see some of the diversity of potential publics of making research open. I ask you to reflect on these because historically there hasn't been very much attention to the actual audiences of open research. Very often the focus has been on making research open to the scholarly community, which is of course really important. Early on in writing about open access, which sort of gained a lot more attention than open science in the early days, Super wrote that open access isn't primarily about bringing access to lay readers. If anything, it focuses on bringing access to professional researchers whose careers depend on that access. However, really crucially, even in this very early writing about open access, he also acknowledged that there is a potential in making this research open for other scholars to benefit that lay public. Specifically, on the very same page, he writes that there's no need to decide which users are primary and which are secondary. Open access is about bringing access to everyone with an internet connection who wants access regardless of their professions or purposes. And research from my doctoral supervisor, actually, Juan Pablo Alperin, has actually found that as many as 35% of people who access open access research do so for personal purposes. So this suggests that there is a public beyond this non-expert or beyond the expert community who has an interest in using research. And this idea of broadening access to a public audience has gained a lot of prominence in the recent UNESCO recommendation on open science, which defined open science as a set of principles and practices that aim to make scientific research from all fields accessible to everyone for the benefits of science and society as a whole. So in a contrast to that early conceptualization of open access, you see here that science and society are being put side by side as the core beneficiaries, the key audiences of making research openly available. And what my research group has seen is that during COVID-19, this broader view of open science took up a lot of space and increasing focus within the debate around open science. This is an analysis of some of the key documents relating open science to COVID-19, and we saw this sort of engagement with societal actors come up again and again, and often with reference to that UNESCO recommendation on open science, which seems, at least based on this study, to have had quite a big impact on the way we think about making our research open. However, another study that we published, when we looked at the way open science is discussed in actual policies about open science within Europe and the Americas. So rather than just documents providing arguments about open science, what does it mean to put it into practice from a policy perspective? We see that this broad view of open science is much more an abstract concept that's still not very much reflected in the practical policies that we've put in place at many institutions and organizations and at the national level. Specifically, our results showed that open science policies overwhelmingly focused on making research outputs publicly accessible, neglecting to advance the two aspects of open science that hold the key to achieving an inclusive scientific culture, namely equity, diversity, and inclusion, and public participation. Now, I've bolded these two terms about public accessibility and public participation because they're very often treated as if they're synonymous, but in fact, they're very different. Specifically, making something accessible, making it so that people can find it, see it, read it, does not necessarily make it useful. It doesn't necessarily mean that people can understand the research, can use it to make informed life decisions, or crucially, contribute to it meaningfully. Can they participate in the research process? Can this wider public really play a role in science? And can science really play a role in their lives? And Kelly and Autry have really beautifully conceptualized this as providing material access to research and some conceptual access to research. Essentially, making your research free to access provides material access. It means people can they don't have to go over a paywall to access your work. But that is, while an important first step, not sufficient for ensuring that they conceptually can access that research, that they can understand and use it. And this is where science communication, a field that has been dedicated to studying and advancing the ways in which the public can understand, engage with, and participate in research, is so crucial. And specifically, what I want to focus on largely today is the role of science journalism, which is really where my research over the last 5 years has focused. And over the course of this presentation, I want to convince you that journalists can be really crucial brokers of open research knowledge. That is, they can play a really crucial role in making research knowledge public. And we make this argument in a review that we published in F1000 quite recently, looking at all the research that has looked at how journalists use and communicate about open access research, where we find compelling evidence that journalists can help bring open research outputs, specifically papers and preprints, into the public sphere, and that in doing so, they can not only provide material, but also conceptual access. That is, they might share research findings or communicate the summary of findings of research that people would otherwise not access and certainly wouldn't come across or find. But they also are really skilled at breaking down the jargon-laden, complex, technical nature of research into a language that people can understand, but also crucially communicating the importance, the significance, the impact of that research for the public, for society, for policy. And so in this sense, journalists are crucial brokers of research knowledge who can support the open research or open science movement in making research not only materially accessible, but also conceptually accessible. But that same literature review, as well as my research and my team's research more broadly, has shown that openness brings both exciting opportunities for science journalism, but also really crucial challenges that we as a scholarly community need to address if we truly want to achieve this inclusive, societally engaged form of openness that recommendations like the UNESCO recommendation have advocated for. And I'll demonstrate these opportunities and these challenges through 3 specific areas: how journalists use open access research, how they engage with open data sets, and finally, how they engage with preprints or unpeer-reviewed research papers that are publicly available before they've been published in a journal. First, let me briefly turn to journalists and their use of open access papers. In our interviews with journalists, we found really interesting findings about how they understand open access, why they turn to open access journal articles, but also why they avoid these journal articles in some cases. Specifically, in interviews with journalists who frequently report on research, they've told us that they find open access useful on a really practical level because they sometimes struggle to access research papers due to paywalls. They've also told us that they see it as this ethical must do that because so much research is publicly funded, it should also be publicly accessible. Crucially, however, journalists who report on research are extremely diverse. And this appreciation of open access was really only true for some journalists in every study we've ever conducted. In addition to journalists who have this deeper understanding of the open access movement and understand it as key to the public good, there are many journalists who are actually suspicious of open access journals and who equate quality research as research that has been published in top, quote unquote, peer-reviewed journals, many of which have historically been closed, and even today, though they are open, require scholars to publish at exorbitant costs that excludes a large amount of the scholarly community, places like Nature, Science, Cell, etc. And in more recent research, this is a preprint, it's currently still under review, we found that journalists, like many scholars themselves, have often start to conflate open access journal publishing with predatory publishing. So again, we see them relying on top high quality journals, placing their trust in them almost uncritically, whereas newer open access journals, like many diamond open access journals, are treated with more suspicion. This obviously has really important implications for the diversity of the kind of research that ends up getting media coverage and ends up making it out into the public sphere. And while these findings are, to me at least, really interesting and have important implications, they're also just the tip of an iceberg. Because our review of the research that I showed you earlier suggests that we really know almost nothing about how journalists are engaging with and thinking about open access or what this means for the public and for science. So if anybody needs research ideas, highly recommend doing anything in this space will be useful to us. Beyond open access journal articles, I want to speak to how journalists have been using open data sets, which are data sets that are shared publicly so that others can use them, do secondary research on them, scrutinize them, validate them. And research in this area is even more preliminary, but a recent piece of journalism that I wrote myself for the Open Notebook, I spoke with 7 journalists who use open data sets to tell science stories. And these journalists told me that they found these data sets really useful for doing things like adding additional context. For example, if they were writing a story about inequities in healthcare access, they might find a data set that helps them show which kinds of people are most at risk of being overlooked by the healthcare system. Or they might use some quotes from publicly available interview participants to provide a more personal lens to their stories. They also did firsthand investigations of data sets to call attention to problematic aspects of science, to monitor the powerful. And finally, they used open data to tell impactful science stories, sometimes to bring a more personal lens to otherwise technical coverage of research. And very similar to what journalists said they appreciated about open access research articles, journalists said that they appreciated these open data sets because they were free to access and thus easy to use and explore. This let them have a preliminary look at the data available and come up with new story ideas. In some cases, stories that other journalists weren't reporting on, exclusive ideas that helped them stand out from the massive competition of journalism. But, and this will come up again when I talk about preprints, journalists also really struggle to verify and analyze these data sets because that typically requires time, resources, deep expertise that journalists may not have, as well as good metadata that spells out the limitations, the use cases of the data. And fundamentally, journalists said that they needed collaboration from other researchers to be able to do this kind of verification. Many of them recalled working directly with the researcher to analyze the data, clean the data, but also interviewing researchers about data sets to understand what's the context that this research data applies to, what are the limitations I need to be aware of if I choose to use it in my reporting? But while this is very promising from the perspective of making data more publicly accessible and understandable, it seems that these journalists are a minority. In fact, writing that article, it was very challenging to find journalists who could effectively speak to their use of open data. And in a review that we just published a couple days ago, we found that at least within data journalism, which is a very obvious use case for open data sets, there was very limited evidence that journalists were really using these data sets in their work. But crucially, again, there's very little research on this topic, as we found in our review. And what we do have in terms of research is often not methodologically done in a way where it's very easy to know whether a data set being used is openly available or not. Essentially, the data journalism community, at least, has not turned much attention to how these journalists are using open data. And so we need more research in this area to really know how and why journalists can help broker this knowledge. Finally, I want to turn my attention to journalists and their use of preprints, which are unpeer-reviewed but publicly available research papers. And this is probably the area of research where we have the most knowledge, which was largely due to the focus on preprints during the pandemic, when many scientists started to use these to share their research freely and as quickly as possible to be able to support the pandemic response in those early months. Peer-reviewed research typically takes months or weeks because it was a bit expedited during COVID to come out, whereas preprints are almost immediate. And what we found in our research is that journalists also started to adopt preprints in their work at rates not seen before COVID because, like scientists, they appreciated that preprints were free to access, that they were rapidly available, and because they were so timely, they were directly relevant to the societal issues that they were trying to report on in the heart of this crisis. And what was interesting about COVID is that these key benefits, which have arguably been there all the time, preprints have always been free, timely, and many of them relevant to society. COVID, our research suggests, seems to have introduced many journalists to these studies for the first time. In this sort of scary looking graph, you can see that media coverage of research articles, which is that gray line, the share of that coverage that was focused on preprints leading up to the pandemic was around 2% of articles looking at research. But in COVID, if you see the blue line, media coverage of preprints about doubled. And with respect to media coverage of COVID-related research, which is that pink line, we saw that almost as 15% of media coverage reporting on COVID research was reporting on a preprint study. So this is a huge shift, one which some journalists described as a new normal, one which was kind of exciting from an open science perspective, because it might suggest that journalists might continue this use moving forward, may continue to mobilize these findings beyond the pandemic to help bring research that is timely into coverage of other crises and emergencies. However, our follow-up study suggests that this sort of hopeful perspective is kind of unlikely. This other slightly scary showing graph depicts the share of media coverage of research that focused on preprints in the years leading up to COVID. And then that first surge is the height of the COVID pandemic, those early months. And as you see after that second vertical dotted line, there is a huge drop in the use of preprints in media coverage of research right after the WHO declares COVID to no longer be a pandemic, with the coverage of preprints actually dropping below what we would have expected to see had the pandemic not happened. And this decline in preprints might be because journalists really struggle with these studies. As I told us in interviews, they find it really difficult to verify them, similar to as is the case with open datasets, because they don't have that quote unquote extra safety net, as they put it, that peer review provides. And more broadly, they worried that by reporting on studies whose findings might change during peer review, they might contribute to spreading misinformation. To try to overcome these challenges, journalists leaned very heavily on scientists. They basically did what they described as their own peer review, which was email a preprint out to a bunch of peers that they've identified as having relevant expertise and asking them to comment on the study, to provide context about its significance, its limitations, similar to what you might do in a peer review process, but then on a severely expedited timeline of, in some cases, a day or a couple hours. Beyond this challenge of verification, journalists also really seem to struggle to communicate about these studies and their preprint status. They've told us in interviews that they think it's important for transparency purposes that their audiences know that these are not quite a normal research study, that they are still preprints, that they haven't been peer reviewed. And we've seen when we look at media's coverage of preprints that some journalists do try to communicate this in some ways. In the study depicted on the screen, we found that about 3 in 5 media stories sharing early COVID preprints made it clear in some way that it was a preprint. Things like saying this hasn't been peer reviewed, it's still a preprint, needs further verification. But that also means that about 2 in 5 stories didn't say anything about the fact they were reporting on preprints. They said things like, a study shows, data suggests, or just provided a hyperlink to the study without saying anything about it being research. And this lack of transparency is a bit concerning because media coverage of preprints can spread very widely on social media. In this one study that we did, we found that media coverage of preprints that is then shared on social media is shared twice as often and gets twice as much engagement than social media posts just sharing the original preprint itself. And this study was conducted with just 5 media outlets. So just 5 media outlets covering these studies is generating double the engagement as sharing the study in its original form. You can only imagine what kind of social media impact media coverage of research can have when you look beyond just 5 outlets to the entire news media industry. If you're a visual person, another way of looking at this is the overlaps of the Twitter and Facebook accounts that were sharing preprints and papers in their original form, that's those pink bubbles, versus sharing the media coverage of those same preprints and papers, that's the green bubbles. Not only are these green bubbles much larger, they're also distinct. Other than that very small overlap, it's different kinds of audiences seem to be engaging with research shared on social media firsthand versus research shared in this media coverage form, suggesting that there's a potential to reach a larger and different audience when a journalist covers your preprint than when you just share that on social media. And this is supported by another study we did that found that media coverage of COVID preprints from one media outlet, The Conversation, was not only shared widely on social media, it also was shared to a large community of individual accounts that went beyond the typical scholarly audience of research shared on social media, people like policymakers, healthcare professionals, and maybe most excitingly, ordinary citizens. This is exciting. It also comes with risks, especially if you remember that journalists are struggling to communicate what a preprint is and what that means for their audiences. And our recent research suggests that the public has basically no knowledge for a large part of what a preprint is. In some cases, people had a vague understanding that it's a draft of some sort, but many people equated preprints to things that were wildly incorrect, things like republished versions of articles, unfact-checked news stories, or in perhaps the most concerning answers, plagiarized content. And crucially, even in cases when journalists do try to help their publics understand what these outputs are, it seems to have limited impact on how well people understand this term. This is a lot of doom and gloom. And of course, these risks really need to be addressed. We need better ways to communicate about open research outputs in ways that help people understand the caveats, the limitations, and the potential. But I want to bring it back to this life-saving potential of preprints. When we look at that same social media study that I discussed earlier, and we look at the COVID-19 preprints that got the most attention on social media when they were shared through media coverage, many of them are about life-saving and very publicly relevant data. For example, things about the effects of different intervention timing on COVID-19 spread, things about how COVID spread in hospital rooms, lots of these, the controversial hydroxychloroquine usage. And while this is obviously problematic, many of these preprints were ultimately published in quote unquote top journals. Places like Science Advances, Med, Cell, Science, the usual suspects. So I just threw a ton of information from you. And if you didn't get it all, that's totally fine, because I'm going to hopefully bring it together with a few key takeaways that I hope I can leave you with before we enter the Q&A. The first is that open science, or open research, as we're talking about today, shares some really important science communication goals. Goals of ensuring public access to research, and in recent conceptualizations like the UNESCO recommendation, public participation in research, societal engagement with science. However, historically, and as we see from these policy documents and related discourses, there tends to be a focus on providing the public with material access, of making research free, rather than providing conceptual access, making research understandable, useful, and ultimately helpful to the public. And this is hard for scientists. We have lots of things to do. We're not all skilled communicators. And this is why journalists can be so crucial to providing the conceptual access that's often overlooked in the open scholarship, open research movement. And they can do this by, for example, reporting on open access papers, open data sets, and preprints, as I've shown you today. But to do this, and if you remember one thing from this presentation, it's this slide. Journalists really need help from the scholarly community. They need us to make our research open so they can find it, access it, scrutinize it. But this is just the first step. They also need us to be really clear in the research itself and how we discuss it online, but also in interviews that they might conduct with us. And especially be clear about the limitations of the study. What really are the weaknesses, not just the weaknesses we throw in for the peer review process. And when a journalist asks you to comment on someone's research, whether it's your own or someone else's, it can be helpful to really think about this like a mini peer review, rather than just applauding your colleague's accomplishment, which you should do as well. It's up to you. You have a responsibility to critique, to explain, and to provide the important context for that research that the journalist needs to know if they're going to communicate it to a public audience. Relatedly, consider that a journalist is going to be paying extra attention to your abstract, and for an open data set, things like the metadata or README file. These are spaces where they can get a sense of what your research output is about and which they're going to be using in that preliminary step when they decide whether or not to report on it. In all of this, I think a crucial thing is to shift the way that we think about our research to not only consider how it might impact our peers, the scholarly community, but also how it might impact the public. And in some cases, this might discourage you from posting a preprint if you think that the risks are really going to damage the public's interest. But it could also encourage you to promote your research more broadly, to turn to social media, to reach out to journalists, to ask your press office if they're willing to put out a press release, because you might see that the research you're producing has really important implications for the public. But most fundamentally, I think it is up to us to change the narrative around what we call good science. As I've pointed to in several of the studies I discussed earlier, journalists are so reliant on reputation-based metrics that we know are problematic. Things like journal prestige, impact factors, citation metrics. And it's up to us to change the way that we talk about what quality research means when we engage with journalists, when we talk about good science in the public sphere. And it's only in doing this, in considering these alternative publics of our work, that we can really move from making research knowledge open to making it truly public. Thank you so much for your time. I look forward to hearing your questions and comments.